The African continent hits the 500,000 mark with regards to COVID-19 infections. There are growing calls for countries to scale up their public health systems. The World Health Organization's regional office has just held a briefing on coronavirus vaccine development. For more on that, we're joined by eNCA reporter Khaya Khumalo, who is keeping a keen eye on developments there. So how are the clinical trials progressing, Khaya?
Well, Dudu, if you go back to the 23rd of June, so it was a landmark moment when the Wits University announced that alongside the Oxford University in the UK, alongside so many other partners as well, they were working around this particular clinical trial. So the process is a very rigorous one. We know that so far they've got about 2,000 participants, and it's a very critical time for the continent. We know that so far 5 countries, including South Africa accounting for just 43% of all the cases in the continent. So Professor Mahdi of Wits University, one of the principal investigators, said the process is still underway to try and get to the bottom of this, because we do know that a vaccine is a very important tool in mitigating the effects of COVID-19. So let's take a listen to Professor Mahdi.
In terms of where we are right now, we started enrolling into the study just over 2 weeks ago, and there have been certain challenges that have been experienced. The plan is to enroll 2,000 participants over a period of 4 to 6 weeks, and then the plan is to follow them up to about 12 months. But the timing in terms of when we would get the result as to whether the vaccine potentially works or not is probably going to be sooner. And the reason for that is because of the really high rate of transmission that is currently occurring in South Africa. So we would be able to determine whether or not the vaccine works when we got up to about 42 cases of COVID-19 that has occurred in participants. And we anticipate that would likely occur as soon as November or December of this year. Previously, we had projected it might only occur in June of next year.
So, Khaya, also, what do we know about the panel that is being set up to examine the World Health Organization's response to the pandemic, as well as independent countries? We understand that it would be headed by former Liberian President Ellen Johnson Sirleaf.
Well, that's right, Duduzile. So in as far as the World Health Organization is concerned, they do insist that this is a time to reflect. And we know that in certain quarters they've come under fire in terms of how they've handled the pandemic. You go to the United States of America, where President Trump has been one of the very fiercest critics of the WHO. So this is a time to look at how have they performed in terms of handling what is one of the biggest pandemics in our lifetime. So it's going to be a very crucial moment, and these are very key individuals, very eminent people who are known in the global sphere in terms of how they've played their role in their respective countries. So other than just the former Liberian president, we know that also Helen Clark, somebody also who's a very great advocate of public healthcare service, a former New Zealand Prime Minister, will be part of the team. But we're yet to establish in terms of the independence of this panel, how they're going to work in terms of delving into how the WHO has performed. So undoubtedly they will have a very big task, especially because when you look at the African context, another issue that came out during the briefing was the whole issue of how whether are Africans really being used as guinea pigs in this regard as the trials are conducted. But the WHO was very insistent in saying that it's a voluntary program. So a lot of people that came on board came on their own accord, and a lot of them really came because they want to assist in terms of making sure that the vaccine is eventually found.
Opinion deeply divided on that issue. Khaya Khumalo, thank you very much.